Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 145,415 confirmed cases of COVID-19 in Canada, and 47,274 cases are in Ontario. Chatham-Kent has 366 cases, and Sarnia-Lambton has reported 344 cases. Michigan now has 117,406 cases, with 14,219 cases being in Detroit. Today, we are reporting a total of 2,634 cases of COVID-19 since March, an increase of 3 cases from yesterday. One is a close contact of a confirmed case, one is a resident of a retirement home, and one is still being investigated. 2,467 cases are now resolved and 91 people are active and being followed by our health unit. 3 people are in hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Parents are encouraged to use the ministry's assessment tool, which can be accessed through our website or ontario.ca. Symptoms of COVID can range from mild to severe, and some common symptoms include fever, a new or worsening cough, a barking cough, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Windsor-Essex has 3 assessment and testing centers: St. Clair College Sportsplex, Windsor Regional Hospital Olette Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick access online, you may receive your results before the health unit contacts you. Please continue to visit our website at we2.org for the most current information on schools and workplaces. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. As we talked about yesterday, and you're aware that the province of Ontario reduced the size limits for indoor and outdoor private gatherings. Previously 50 and 100, now private gatherings are restricted to 10 indoors and 25 outdoors. We have received a number of questions related to these gatherings and rules. To help clarify, indoor and outdoor gatherings cannot be combined for a private party of more than 35 people. If you are planning a party and want to use both indoors and outdoor spaces, you are restricted to the maximum of 25-person total for your party, and only 10% would be allowed indoor at any given time. Please also be reminded that private gatherings are not the same as your social circle. Any gathering you are planning must ensure that physical distancing of 2 meters is available and is feasible for all attendings at all times. All other measures must also be in place, such as hand washing, respiratory etiquette, and staying home if you're sick, with even the most mild symptoms. We must continue to adhere and be mindful of these measures and restrictions to protect the health of each other. COVID-19 can spread very quickly among gatherings. We must do all our part to stop the spread and break the transmission of COVID-19. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with CBC.
Yes, good morning, Dr. Ahmed. Wanted to ask you about a little bit more about COVID-19, the actual disease itself. I'm wondering, are we seeing in Windsor-Essex a lot of patients that are experiencing really long-term effects of the symptoms associated with COVID?
Well, this is an area that's currently being studied right now in terms of the long-term effects of COVID-19. There are a number of health issues that are identified as a sequelae of someone who contracted COVID. So some of those things are currently being studied, and I know there are a few people who are being monitored and followed up as a result of COVID-19, even though that they had their initial diagnosis 2-3 months ago. But at this point, from a purely scientific perspective, I cannot list you what are the sequelae that is scientifically proven and that we are following at this time. But this is definitely an area of research at this time. As we move forward, we will see more of these issues, and that will be a better place to paint a picture of what kind of sequelae are possible and what kind of follow-up is needed for some individuals with COVID.
Is that kind of information being tracked by our local health unit?
It's not tracked at local health unit level just because we may not see that many cases locally. And some of these data are analyzed at the provincial level or sometimes at the national level. So it's really depend on the rarity of the disease and the rarity of the symptoms. But some of that work is generally done by Public Health Ontario, who are pulling out all that information from the entire province. And they also work closely with the hospital system, the Institute of Clinical Evaluative Sciences, ICES data, and then they combine all those data to paint a better picture of what's going on from a clinical side and then what's going on from a public health side. And then they do some of that analysis and then make some of those reports and data available. And if many of the scientists, they take on those research projects and also work on it independently and then pull that information together. So I think there are a number of avenues. We don't do it at the local level, but there are other academic institution, provincial and federal agencies that track that information.
Thank you, Dr. Ahmed.
Any questions from AM 800?
The question's for Teresa. Actually, I'm not even sure if it's for Teresa or it could be for Board Chair Gary McNamara. I know he's not there. But Teresa, has the health unit since day one, is there any lawsuits underway in regards to COVID, the way the local health unit has handled it? Has the local health unit been served at all?
So we do have some pending issues. I'm not really able to speak too much more about it, but there are some legal issues that have come to our attention.
Can you give us a ballpark number? Is it 1? Is it less than 10? Anything like that you can share with us?
Less than 10.
And finally, just to that point, I know you can't share, but disappointed, frustrated, angry, because I know you and your team since day one have put a lot of hard work, effort, working around the clock, and to deal with something like this also, I guess, is it disappointing, frustrating?
Well, we're all learning a lot through the pandemic, and I'll just say that we're dealing with every issue that has been brought to our attention and that, you know, has resulted in different perceptions and different views of how we've handled the pandemic. But I do maintain that the health unit's done a great job, and we continue to have the best interest of our community with every decision that's being made.
Okay, thank you very much.
Any questions from Blackburn?
Hi, good morning. It's been a week since the first cohort was sent home from the first case within a school. Is there any evidence of transmission within that cohort yet?
No, everything, there have been no further secondary cases at that school, so at this time, so we continue to monitor the situation, but at this time, no further transmission.
Thank you.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. Good morning, Teresa. There's a lot of anticipation for Doug Ford's announcement today, his fall preparedness plan. So I know you're probably not privy to what he might say today, but is there a wish list? Would you like to see something in this plan in particular?
Bob, obviously we have learned a lot as we have dealt with this pandemic right from the beginning in our region. And I think, as you all know, our region is one of the hardest hit region for COVID, and we have the highest rate of COVID in the province. Some of our unique challenges continue to be with the temporary foreign workers, our borders, our long-term care home and retirement home residents. Those are our key areas, and that requires some focus and attention. So from our perspective, obviously, there is a provincial body that's working on the long-term care home, retirement home outbreak planning. There's some local work that's been happening with our health system partners to deal and manage the outbreaks locally in the region. We do have we learned a lot with dealing with the temporary foreign workers program, and I know we are still waiting for some of the confirmation from the different levels of government to support the isolation center for the temporary foreign workers and at the border issue. So I think those are the key areas that we continue to see and experience many challenges. And I'm sure that when with this fall preparedness planning, those will be touched and those will be covered. In any case, our local health unit is trying to work with all the relevant stakeholders and partners to address the issues that are relevant for our region.
Okay, so having gone through what we went through with the LTCs and agri-farm workers and the farms overall, do you think we're in a good position heading into possibly a second wave?
Well, I think we can say that we learned a lot. We built new partnership. We built new protocols. We have modified many of the work practices that we are doing, and similarly, many of these partners are modifying and adapting to the new reality of COVID-19. So from that sense, I think there may be we may be in a better position. But the bottom line is what we are dealing with is a lot of that is human behavior. And when we're talking about human behavior, people are talking about COVID fatigue. People are not willing to do what they need to do to protect others or to follow some of those same protocols. I think that's the challenge. And there is no easy way to say it other than just saying that it's all in our hands. How we behave, how we deal with it, it's entirely up to us. So far, what we are seeing in the province is the result of those irrational behavior and resulted in a number of cases across the province. We are lucky, knock on woods, that we are still seeing a relatively stable number of cases in our region, and we like to keep it that way. And I think this would be a much bigger problem, that if we start to see a rise in our cases and then questions raised by the province or any other levels of government to start thinking about shutting down some of these services, shutting down some of the things that are currently open. So I think we need to be careful, and we need to recognize that all of us have to do our part to keep us to a place where we are right now. And as long as we are doing it, we learn from what we have been through, what our region has been through. I think we will be in a better position, but all of us have to work together to feel better, to prepare better, and to continue to follow the recommendations and guidelines that are put forward by us, by the province, and by every other agencies as well.
Great. Thanks a lot, Doctor.
Any questions from the Windsor Star?
Not at the moment, thanks. We've all been covered so far.
Okay. Any further questions from CBC?
No, thank you.
AMA 100?
Dr. Ahmed, in regards to the close contacts, are any of those since the weekend and since your presentation last week added to the second community clusters? The number 20, has that increased?
I don't think so. I don't think that we have increased. I think what we probably reported when probable, that we got some final results from that. So that probable is now confirmed case. That's the only change that we have noticed. Other than that, I think I haven't seen any increase in that cluster.
Okay, thank you. Have a good day.
Thank you.
Any further questions from Blackburn,
No, thanks.
CTV?
Yeah, actually, just wondering, is the close contact today related to any of the schools?
I don't think so. No, it's not linked to the school. No, I remember now. It's not linked to school. Yes.
No? Okay,
Yeah.
just checking.
Yeah.
All right, thank you. Have a good day.
Thank you.
Any further questions from the Windsor Star?
No, thanks.
Okay, thank you, everyone.
Thank you.